Hi, it's Dr. Walt Medlin, and I just wanted to take a minute since I did my open enrollment for insurance just now with actually my wife doing all the work. But it is that time of year when people who lack coverage for obesity or obesity-related care with their insurance to think about firing their insurance company. This is the time to go to HR if you're at a large company, or your employer if you're at a small company, and ask what your coverage is exactly with each of your options. And a lot of times you're only actually given one or two options to look at, but it's time to ask if there are other options that aren't shown or aren't often available. The city of Salt Lake actually went through this in the last year, where they went to PEHP, their plan that they administer through, and said, we want to add coverage. And we're told that it would cost 2 cents per employee per pay period. So it cost the entire city for all of its employees barely over $100,000 to cover everyone for obesity care where they had not covered it at all before. So it made a huge difference just to have patients asking HR and letting them know that they cared. If you're a municipal employee in the state of Utah, this is definitely the time to start asking that question. It may not make a change for this year, but it might. You might have options that you don't even realize exist. And certainly, if you're an employee at certain places with very limited coverage, it's time to start asking for that to be modernized. Federal employees, all federal plans are required to have coverage. Medicare, Medicaid has great coverage, so time to start asking those questions. Open enrollment, I want to remind people to think about that now. This is not the sort of thing, there's a lot of stuff we're doing that's very long term, that's going to take months and years, but there's stuff that you can do right now. And if you've already had surgery, or if you're already in care, it's reasonable to go to your HR and pay it forward and say, why don't we cover for people who are looking for this? If you had to self-pay a couple of years ago, and I was actually able to do that when I self-paid for surgery, to make sure that policy was changed for the next year. So it's a great way for people to have direct impact for yourself or others, and I hope everybody's gonna enjoy. I think you'll be amazed at how much Health and Human Resources folks actually like talking about real issues beyond just cost. A lot of folks who are in human resources really want to help people have a better life, but they have to prioritize, and having those discussions really helps them focus on important issues and not just window dressing. So hope that helps. There's going to be a much more extensive version of this from our professional videographer at the Bariatric Medicine Institute that I think is going to be up on our website within a few days here. So look for that as well. All right, take care, everybody.